Clinical Pearls, brought to you by Medicom Oncology.
Hi, I'm Dr. Joshua Richter. When do you need to do a bone marrow biopsy in the management or assessment of multiple myeloma? Because multiple myeloma involves proteins that circulate in the blood, for the most part, we don't need to do routine bone marrow evaluations to monitor our patients. However, there are discrete times which it is very important to do a bone marrow biopsy. First, it's important to do on a diagnosis. This allows not only assessment of overall disease burden, but also evaluation of cytogenetic risk stratification. Anytime a patient is part of a clinical trial, a bone marrow biopsy is usually obtained to evaluate the patient prior to study and for correlative work. If a patient has had a deep response to therapy, a bone marrow biopsy is indicated to evaluate for MRD, which is known as minimal residual disease analysis, which can be accomplished through a variety of techniques such as next-generation sequencing and next-generation flow cytometry. Although most patients with multiple myeloma secrete a protein we can measure in the blood, there are a subset of myeloma patients who are what we call non-secretory myeloma, in which their disease burden is not reflected in the paraprotein in the blood, and one of the key ways of monitoring ongoing therapy and response is through bone marrow biopsy and aspirate. The last time that we perform bone marrow biopsies in myeloma is when we have unanswered questions. Oftentimes people with myeloma can have cytopenias that are caused either by disease or by chemotherapy. However, there are times where neither disease nor the chemotherapy explains the cytopenias, and further investigation must be done to look to see whether or not there is oligosecretory disease, as in the disease burden within the marrow is expanding, however it is not secreting the protein in the blood to the same amount, or whether or not something such as another bone marrow disorder like myelodysplastic syndrome is lowering the blood counts. These are the main reasons that we do bone marrow biopsies in myeloma, but again, for the majority of our patients, it is not a necessary step to take for routine evaluation.
Don't forget to subscribe to the Medicom Oncology podcast channel for more clinical pearls. And be sure to visit managingmyeloma.com for more practice resources.